Hello, my name is Cameron Dukes, and my topic is viral hepatitis. What is viral hepatitis? Hepatitis is an inflammation of the liver. Many illnesses and conditions can cause inflammation of the liver, for example, drugs, alcohol, and autoimmune disease. Viral hepatitis is the leading cause of liver cancer and the most common reason for liver transplants. Types of hepatitis. There are 5 types of hepatitis: type A, type B, type C, type D, and type E. Most common types. Hepatitis A, B, and C are the most common of the 5 types. Hepatitis A, also known as HAV, is considered an acute illness and never becomes chronic. HIV accounts for 1,781 new infections per year, typically spread through household members and close contacts through the passage of oral sections or stool. Hepatitis B, also known as HBV. HBV accounted for more than 19,000 cases in 2013, and more than 1,800 people died from it. It can typically spread by sexual contact, the transfer of blood or serum, through shared needles, hemodialysis, and infected mothers to their newborns. It can also be spread by tattooing, body piercing, and sharing of razors or toothbrushes. Hepatitis C, also known as HCV, accounts for about 16,500 new cases every year. It can be transmitted by the transfer of blood or serum through shared needles, hemodialysis, and blood transfusions. An estimated 50% to 70% of patients develop chronic infections after having hepatitis C. Some people have no symptoms of viral hepatitis, whereas others develop jaundice, which is a yellow discoloration of the skin and whites of the eyes. They also have poor appetite, vomiting, tiredness, abdominal pain, or diarrhea. Hepatitis may be acute, which is temporary, or chronic, which is long-term. Acute hepatitis can sometimes resolve on its own, or it could progress to chronic hepatitis or very rarely result in acute liver failure. Over time, the chronic form of hepatitis may progress to scarring of the liver, liver failure, or liver cancer. Some symptoms include nausea, poor appetite, stomach pain, fatigue, fever, and jaundice. There may be no symptoms for years, but by the time the symptoms arise, it may already be too late for your liver. Diagnosis. Doctors diagnose hepatitis based on blood tests and a physical exam. Blood tests performed will indicate if hepatitis antibodies are being produced inside the body and which strand of hepatitis it is. Sometimes, imaging studies such as sonograms or CAT scans and a liver biopsy can be performed. Treatment. Treatment of acute viral hepatitis and chronic viral hepatitis are different. Acute viral treatments include resting, relieving symptoms, and maintaining adequate intake of fluid, while chronic viral treatment includes medication to eradicate the virus and prevention of further liver damage. There are only vaccines for hepatitis A and B. Complications that arise from hepatitis are cirrhosis, liver cancer, liver failure, and portal hypertension. Cirrhosis is the scarring of the liver, and portal hypertension is when the portal system of the liver is blocked and blood cannot return to the liver from the digestive system, and the pressure increases. If the liver becomes too damaged to function, the last resort would be a liver transplant. Now it's time for a quiz. Question 1. How many types of hepatitis are there? A, 3, B, 6, C, 4, D, 5. The answer is D, 5. Question 2. What is not a symptom of hepatitis? A, jaundice, B, stomach pain, C, increased appetite, or D, nausea? The answer is C, increased appetite. What type of hepatitis is spread by the transfer of blood and serum? A, type A, B, type C, C, type B, D type E, or E both hepatitis C and hepatitis B? The answer is E, both hepatitis C and B. Question 4. Besides a viral infection, what can cause hepatitis? A cold, B, drugs, C, allergies, or D, a colonoscopy? The answer is B, drugs. Question 5. Which two types have vaccines? A, hepatitis E and B, B, hepatitis A and B, C, hepatitis A and D, or D, hepatitis A and C? The answer is B, hepatitis A and B.